On this urinary model, some of the things we can see. If we come down here and look at the kidney, we can see the renal cortex is this outer layer. Renal medulla is this layer here. We can see the renal pyramids, renal columns, the minor calyces, major calyx. Renal pelvis is kind of tucked under these blood vessels here a little bit, and then the renal pelvis comes out and tapers down to the ureter. And the ureter goes from the kidney to the urinary bladder. On the urinary bladder, we can see the bladder as a whole. We can see the trigone. We can see the urethra. And on this anatomical model, it's a male, so we can see the prostate gland. And these would be the vas deferens, which would go along and tuck on the other side of the bladder and come up to the ejaculatory duct that passes through the prostate gland. Now, if we come back up here, we can see renal artery, renal vein, and the renal artery is kind of tucked under. Renal artery branches into segmental arteries, and we can't really see the interlobular arteries on this model. Well, we can a little bit right here. Then the arcuate artery and the cortical radiate arteries. Now these would be the cortical radiate veins, interlobular vein, and the interlobular veins come all the way through here and they become the renal vein.